Ciao, bentornati. Hello, and welcome back to Richard Harris's Herbal Tutorials. The tutorials that inform and educate about herbs and other natural substances. The tutorials where you feel edified and empowered. This is the aim of these tutorials, so you don't ever feel that you have wasted your time watching them. Here, you're going to learn about many natural substances and herbs, the different parts of the plant and substances used, their various usages, why and when you should use them, and why and when not to. I'm Richard Harris with another interesting and enlightening video. In this video, like all my other videos, pertinent information is given. You get truthfulness. There are no hypes, no exaggeration, no unfounded claims. Your health means a lot to me. And whenever these videos are made, they are made with your best interest in mind. Also, I've decided to number all my future videos from this point onwards to help in finding or referring to a particular video if you think it's necessary or if you feel the need to. This one is numbered 1. In today's video, I'm going to be discussing another interesting herb, internationally known as ASAFOETIDA. This is the dried gum obtained from the ferula plant of the Umbelliferae family. This plant distinguishes itself by the combination of a strong garlic and onion-like smell, which is mainly due to its high concentration of sulfur compounds. This plant is mainly found in the Middle East, Iran and Afghanistan being its principal producers. It is also found in some parts of Africa, Europe, and the Far East. It is not grown in the Caribbean, but it is a fixture in our drugstores and groceries due to its consumption as a medicinal agent and as a condiment. In Iran, this plant is fondly referred to as the food of gods. And like in India, it's a fixture in their cuisine. Please note that this podcast was made for entertainment purposes only and should not be used for the purpose of diagnosis and treatment. If you think you need medical advice and treatment, please consult your physician or health care provider for such. Please remember, natural is good, but natural can and may become deadly, similar to fire. Therefore, information and directions coming from well-intentioned persons without the necessary know-how or experience may cause harm. There is danger in the botanical world. Be careful. If you take your health seriously, as I do, then don't touch that dial. Sit back, put on your thinking cap, make yourself comfortable, and let's embark on another herbal and natural substances extravaganza. If you're enjoying this video, please stop briefly and give it a thumbs up. While you're doing so, please hit the subscribe button and the notification bell if you haven't done so as yet. In this way, you'll be the first to get any new uploads. You could also drop a comment in the comment section, letting me know of any experience you might have had using this herb. Your comments are valuable. I must also thank you for being here. Your loyal support is part of the motivation for these videos. Back to the topic at hand. As I've said above, ASAFOETIDA used to be well known in the Caribbean. Medicinally, its usefulness has been neglected, especially in these modern times. I hardly think the young people know much about it. I hope this podcast aids in it being used more often because it's a wonderful herb with tons of therapeutic benefits. ASAFOETIDA belongs to a group of herbs called digestants, or agents that relieve food stagnation. What are digestants? Digestants facilitate the production of gastric secretion, promote gastrointestinal peristalsis, stimulate appetite, and relieve food stagnation. A term that covers indigestion and retain food in the digestive tract. This class of herbs and substances relieve abdominal distension and promote digestion. Digestive agents have a primary effect on the spleen and stomach, the principal organs of digestion according to the tenets of traditional Chinese medicine. These types of herbs and substances are found to be rich in digestive enzymes. A reminder, please pay special attention to the categories under which the agent is categorized in order to help you to be more selective and specific in your application. Besides being known internationally as asafetida, it's also called the devil's dung because of its peculiar smell and taste. In Ayurvedic medicine, it's fondly referred to as hing or hingu, for which it has a long history of medicinal usage. The same is also true in China, where it is called wei. The part of the plant used is the resin. It has a warm energy and a bitter, arid taste. It is thought of as entering the meridian of the stomach, spleen, and liver. Its chemical constituents are 40 to 60% resin, 25% gum, 10 to 18% volatile oil. The 25% gum includes glucose, galactose, and rhamnose. There are also sulfur compounds. There are coumarins, including galvanic acid, foetidin, and umbiliprenin, calcium, phosphorus, carotene, riboflavin, and niacin. Its functions are varied and many. 1. It warms the center and regulates the qi and promotes digestion. 2. It invigorates blood circulation and regulates mens. 3. It resolves dampness and aids in stopping coughing. 4. It kills worms. Usage: for food stagnation manifesting as sour belching, abdominal pains, and distension, asafetida is used with chicken stomach lining. That's the gizzard, the lining of the gizzard, and germinated barley. 2. Coughing due to phlegm damp manifesting as thick, copious phlegm, used with radish seed and dried Portugal peel. For pinworms and threadworms, make a tea of pawpaw seed to which a little asafetida is added. A 4th usage: a pinch of the gum is added to rice. The rice is cooked and used for postpartum pain and distension. This is a good herb to use primarily after making babies. Asafetida is also used as a good condiment for fatty and greasy foods because it aids in the digestion of fatty dietary lipids. Another usage is for abdominal pain, distension, and diarrhea. Add 1 or 2 drops of asafetida to heated ghee. Apply warm to the umbilical area. For night crying in children, mix equal parts of asafetida powder, fennel seed powder, and powdered ginger. Take a half teaspoon, simmer in a little water for about 2 minutes, and apply warm to the abdomen. 7. For amenorrhea and dysmenorrhea, use with turmeric and rosemary. Asafetida is considered as being useful in boosting fertility in both males and females. It is said to be able to boost fertility in men by improving testosterone levels, boosting sperm count, and motility. In women, asafetida stimulates the production of progesterone, called the pregnancy hormone. This hormone is essential for both before and during pregnancy. It works by preparing the uterine lining for the embryo implantation and aiding in ovulation. Adequate amounts of progesterone not only aids fertility, but it also prevents miscarriages. As you would have noticed, asafetida can be used to treat both infertility as well as unwanted pregnancy. Also, this herb is often used for amenorrhea and for excessive menstruation. Why? Because it regulates uterine functions. That's how many natural medicinal agents function. Additional uses include whooping cough, asthma, bronchitis, dementia, epilepsy, diabetes, breast cancer, diarrhea, postpartum pains, postpartum vaginal discharge, and leukorrhea, among many others. Externally, asafetida is also used as a natural insecticide and is a wonderful addition to your hand cream to ward off mosquitoes and other forms of flying insects. If the smell is overwhelming, just add a few drops of a natural fragrance. Also, a small amount can be mixed with a little garlic powder and applied to insect bites. Asafetida is also found to reduce the production of tyrosine in the skin. Tyrosine is an amino acid that is essential for the production of melanin, which leads to the darkening of the skin. Asafetida is therefore useful externally as a facial application to prevent or limit wrinkles, remove age spots and darkness around the eyes. A useful application as a face mask is made from the juice of parsley, powdered eggshells, and asafetida. Dosage: powder 1 to 3 grams, liquid 3 to 10 drops. Caution: avoid using during pregnancy or when breastfeeding. Overdose may cause dizziness and headaches. Sadly, we have come to the end of another interesting herbal and natural substances extravaganza. I hope you have had the same pleasure from watching and listening to it as I have had in producing it. Before I go, I want to say to all my subscribers, the people who are the reason for these podcasts, I'm sorry for being missing in action for the past 2.5 months. I had some distractions that exhausted me physically and was therefore unable to do my regular post. You are all lovely people and I know you will understand. Thanks for your loyalty. See you soon with another interesting and thought-provoking podcast. Ciao, ciao. Stay good.